Hi, I'm Lucy Macdonald, physiotherapist, and today I'm going to talk to you about the difference between good pain and bad pain. What kind of pain is it okay to run through? Which kind of pains should you get checked out? How do you know? So I'm going to equip you with some information that will help you to make those decisions that I know from previous experience with all my previous patients. I know that they find really helpful. So firstly, what's good pain? Okay, so the process of getting fitter involves creating microtrauma to the tissues of the body. So whether it's your muscles, your tendons, your heart, your lungs, you name it, you create some microtrauma. So some of the fibres actually get damaged. Now, as a result of that damage, you get an inflammatory response. Now, inflammation gets a bit of a bad reputation, but actually it's the first stage of healing. So it's a good thing in small measures. When you get that inflammatory response, you will feel pain in those tissues that have undergone microtrauma. And as long as that pain is not too intense, which we'll cover later, that's a good sign, because then what happens is something really fabulous. Your body responds by creating more cells, bigger cells, more resilient tissues, stronger tissues, and an all-round fitter, stronger you, which is amazing. So that's the process of getting fitter and stronger when you're training for an event like a marathon. And that's why, as I say, there is such a thing as good pain, because that pain is a sign that you are pushing yourself enough and therefore you're getting stronger. However, there are a few things that are required to make sure that that process happens properly, and that's proper recovery and nutrition. So you need to make sure that you're getting enough sleep. You need to make sure that you're doing things like cross-training, that you're managing your stress levels, and most importantly, really getting enough of the right nutrients into your body. So all of those things combined result in a gradual build-up in fitness. So when does it go wrong? Now, it goes wrong if any of those components are out of kilter, or if a combination of them are out of kilter. So the most obvious one is if you increase the amount of strain and increase the amount of intensity of your training too much, that creates too much trauma to the tissues of the body. So instead of just a little bit of microtrauma, you create a lot of trauma, which then results in excessive inflammation, and then you end up having to rest because it's too painful to move, and then you hit a negative cycle of weakness, damage, weakness, damage, weakness, damage, weakness, damage, and that's when things are obviously going wrong. So that's the first thing. The second thing is if you're not putting the ingredients of recovery in place. So if you're not getting your nutrition right, if you're not sleeping properly, if your stress is out of control, all of those things will prevent that amazing process that I was talking about from happening. So what does that feel like? What does it feel like when you're getting it wrong? There are 3 guidelines that I give my patients that I think they find very useful. And that's, the first one is the intensity of the pain. So if 10 is the worst pain that you can imagine and 0 is nothing, on that scale, if your pain is around about a 3 out of 10 or less, then that's probably the kind of levels of pain that your body is an indication of microtrauma that your body's then able to cope with, and that regeneration and strength and fitness process can occur. Now, I say 3 out of 10, obviously that's in the absence of any kind of painkillers and presuming that you've got normal sensation for pain. So on that scale, 3 out of 10 or below. The next one is how long the pain lasts. Now, inflammation can actually take 72 hours. So that's why sometimes if you've had a more intensive training session, you can feel more pain 2 days later rather than the day after. So that's completely normal. If your pain is lasting more than 3 days, then, or 2 to 3 days, then something's going wrong. You're putting too much strain through the body. And the third one is how long the pain no, not how long the pain's lasting, that's the one that I've just covered. The third one is the localisation of the pain. So if the pain is, for example, localised to your knee or your hip, it's not just a generic pain throughout the muscles and the tissues of the body. If it's a specific pain, and it might move around, so you might get a pain in your knee one day, pain in your foot the next, hip the next, etc. That's not normal. If you're getting multiple localised injuries like that, or just one localised injury for that matter, then something's going wrong with your training process, and you need to take a look at your training programme, take a look at maybe introducing some strength and conditioning work, maybe looking at the biomechanics of how you're moving and running. So those three things, so let me just run through them again. If your pain is 3 out of 10 or above, if your pain lasts for 3 days or more, and if your pain is localising, so any of those three things, if any of them are the case, then you do need to get your pain checked out. And I would recommend that you get your pain checked out by someone who's accustomed to seeing large volumes of runners, so that they can advise you with expertise. So someone like a sports doctor or a physiotherapist who, as I say, sees large numbers of runners. If all of those three things don't apply to you, then you can celebrate the pain that you're experiencing as part of the amazing process of getting stronger, more resilient and fitter. So I hope that's been helpful. If you want to get in touch with me, my email address is lucy@octopusclinic.com, or you can follow me on Facebook, Twitter, YouTube, Instagram, at Octopus Clinic. And in the meantime, please do let me know if you have any topics that you'd like me to cover. And until then, happy running.